Welcome to the SwineTime Podcast here at Pipestone. I am your host, Spencer Wayne. I am one of the staff veterinarians here at the clinic, and besides getting to work with farmers, I get to interview interesting people. Sometimes they're not in the company or not employed by the company. Sometimes they are. And today I'm interviewing Paul Frahm. Paul Frahm is the director of Pipestone Applied Research. Am I correct in that title?
Correct.
Okay. Paul, would you spend a couple minutes and just introduce yourself and let us know who you are, where you're from, if you got any family members you want to say hi to over the podcast here, and what you do now and how you got to that spot?
Yeah, I live in Laverne, 30 minutes south of here. I have worked for the company in a variety of roles. I started out actually many years ago in a sow farm down in Iowa.
Which one?
Legend.
Legend? Okay.
Yep, way back when. A couple years later, I ended up managing Sleepy Hollow down there, right across the road. I worked at Whitetail Run for a while, and my old boss, Dan Hansen, said that he was looking for somebody to come up here and help him with research. So 12 years ago, I came up here and started doing this.
Okay, now I get the connection with Dan, because Dan, your predecessor, would have been a Legend, the manager at Legend.
Yep, he was the manager at Legend when I was down there.
Okay, one thing connects to the next. All right,
that's right. I have a family of 5 at home. I have a wife and 4 boys, ranging in ages from 22 down to 7. So pretty busy home life right now.
Yeah, I'd say you kept your wife busy for several years there.
Yep. Okay. It's a lot of activities, a lot of sports, a lot of fun things outside of work.
Okay, good. And how long have you been doing your current job here?
So the current role as director of operations, I've been doing that for about 7 months now. I've worked with research for the last 12 years, like I said. When I started, there were 2 full-time employees and 2 part-time employees, and a total of 2 barns. By the time we were at our max capacity, we had 6 barns, 8 full-time employees, and 6 part-timers.
Okay.
We're down to 4 barns right now with 5 full-time employees and 3 part-timers.
Okay. Before we go any further, we said Pipestone Applied Research, and you'll hear it abbreviated as PAR. Can you take us through a little bit of history of, like, what is that? What does that even mean? What kind of research does PAR do? Take us through that a little bit. I got a couple comments that I can throw in there as you're describing it, because I remember as PAR came to be as well. But why don't you take us through what PAR is?
Yep. So PAR stands for Pipestone Applied Research. It is a very production-based way of looking at research. We have 2,400 head production facilities or regular barns that we put pigs in, and we do things on an applied research level. So what people are seeing out in the field, that's what we try to replicate, so that we can take those answers back to the farmer to say, this is what we found in a similar situation to what you would have.
Yeah. So if a farmer listening has got a 2,400 head wean to finish tunnel barn, like a 1,200 head room, single middle divider wall, two curtains on one in each room, and a bank of fans at the end. Just a classic tunnel barn. That's exactly what you're talking about. 2,400 head tunnel barns.
Yep, that's exactly what we have. The inside is set up slightly different with a smaller pen size, but that's so that we can get more replicates of the treatment that we're trying to test.
Yeah. So you'll have generally smaller pens. You've got a trolley with a feed delivery system on it that'll drop certain diets into different feeders, so you can do feed studies.
Yep.
Right?
Yep. We do. We have we call them our feed robots. They go around to each pen individually and record the amount of feed that's dropped into each feeder. So essentially, when we also have scale in the barns that we can weigh entire pens on. So every time we do that, we can track how much feed has been delivered, how much they've eaten, and how much feed it's taken for them to grow that much.
Okay, and I know you got split water lines too, so you can medicate differently in different pens, at least in some of the barns.
Yep. Every barn is set up with at least 2 different water lines, so we can run water medication into certain pens if we want to. Essentially, we can run tests on different water medications if that's something that we're looking to do.
Okay, so very typical of what a producer would have for their barn, but with a lot more sophistication inside. But same setting, same ventilation, same size, same dynamics within a group of pigs, except slightly smaller pens.
Yep. We really try to keep it to a level where we can go back to the producer and say, we did this in a very similar situation to what you would have, and this is what we found.
Okay. So I'm thinking of things that would explain a little bit better what you're dealing with every day. We can source our own pigs from one of the sow units. We'll find a sow unit that's got the right genetics, that's clean and healthy, that you can get pigs from to fill that barn, and then we'll do the trial that you want to do. But we can always source the pigs with good, clean pigs somewhere within our Pipestone managed farm system, correct?
Yep. Depending on the study that we want to do, that will determine the sow farm that we want to go to. We might want a little bit more of a health challenge pig to try to run one of these health studies on. Or we may want a clean pig, a healthy pig to run some of these genetic studies on. It all depends on the study and what we're looking to accomplish.
Okay. Speaking of that, what kind of studies do you do? Like, what different things would you even look at in your research barns?
So a lot of our studies are either genetic or health related. We will put two genetic lines against each other. So we'll feed them out, we'll weigh them at every diet change, and then we'll just see who outperforms the other one.
Classic version of that is at the unit, they breed with this boar or this boar.
Mm-hmm.
And they keep track of who they are. When they send them to you, they got a red tag or a green tag. And then you split them up in your barn, and you grow them up, and you determine which boar genetics gave a faster or better growth.
Exactly. And it's not always growth that we're looking to determine. Sometimes it's morbidity, sometimes it's mortality. But yeah, essentially we pit the two genetic lines against each other and just see who wins depending on what final outcome we're testing.
Okay, so that's genetic. And we can do the same thing rarely, but sometimes with sows, because a unit might have two different sow lines in it.
Mm-hmm.
But typically boars. You mentioned health.
Mm-hmm.
What kind of health studies would you even do? Like types or examples of what do you mean by health study?
So a lot of the health studies are testing different vaccines against each other. As we all know, there are many different health companies out there to choose from. Most of them have similar products. So what we'll do is we'll take whatever source of pig we're looking for. We'll take the two versions of the vaccine that we're looking to test, and we'll vaccinate half the group with one vaccine, half the group with the other vaccine, and do the same thing, see who outperforms the other.
Okay. Sometimes I know we do challenge studies.
Mm-hmm.
What does that mean versus I just gave two different vaccines to these pigs and they grew the same or they didn't grow the same? What's a challenge study?
Yeah, so a lot of the health studies do come with an intentional challenge, and what we'll do is we'll take typically 3 pigs per pen, and we'll intentionally inoculate them with whatever disease we're testing.
Like PRRS, for example.
Yeah, so like PRRS, for example, if we have 2 different PRRS vaccines that we're looking for, we'll get 3 pigs in each pen that haven't been vaccinated for anything, and we'll intentionally inoculate them with the PRRS virus, and that will help us determine mortality percent of a different vaccine, growth of a different vaccine, or any of the other metrics that we're looking to test.
I remember this coming up, how we do the challenge, since we're talking about it. You said, we get 3 pigs, and we refer to them as cedar pigs, I think.
Mm-hmm. Yep.
And so you'll infect them. They become your shedders. They spread it around the barn. We did some initial studies where we said, we'll put the pigs in, and then we'll give them all a shot of PRRS virus, like live virus. And then we had several examples where the pigs didn't get sick. Mm-hmm. It was really weird. We think, I gave every pig a shot of PRRS virus, live virus, and they didn't get as sick as if I just put 3 pigs in and let those 3 pigs shed it around the barn. That's a fair statement, or did I describe it accurately?
No, that's a completely fair statement. What we've learned is that with the cedar model, the 3 pigs per pen, it's more of a real world scenario where, you'll get a handful of pigs here and there that are sick, and eventually it just spreads to everybody else. Where if you inoculate everybody all at the same time, they all get sick at once, they all get better at the same time. So it's not as real world scenario that a producer would see.
Yeah, it's really strange because it's counterintuitive just to infect a few pigs, but I think you let the PRRS and every other thing that goes along with it brew up at the same time.
Mm-hmm.
And the last pigs that get infected get walloped with about everything that's floating around the barn versus if they all got it at the same time. Yep. All right, enough in the weeds on that. So health product studies, like vaccines typically, could be medications of different kinds, but challenge studies. And I know we've done genetics and challenge studies where we'll say this boar is a really tough boar for PRRS, like it'll take a lot of PRRS where the other boar won't. We'll do a health by genetic studies at sometimes as well, correct?
Yep. We've done that in the past. It all depends on this. The studies that we do depend on what's relevant in the field today. So if we're getting questions from producers or veterinarians or anybody that says, hey, I think that this is going on, if we think it's relevant, we'll take a look at it and just see if there's some answer that we can produce that will help people out.
Okay. What else do we test? I can think of one thing, but I'll let you answer. What else do we test?
We test a variety of things. We have done some feed additives in a couple of our barns to see, how those help the growth of the pig, how they react with virus, whether or not they work as a mitigant. We do have one of our barns that we call our technological barn. So we've done some power washing robot stuff in that barn. We've worked on some camera stuff, some water meter stuff.
Didn't you look at a bunch of feed space by pen size or density studies? Was that one of the barns, or you do that in a lot of the barns?
That was one of the barns. We actually remodeled from a standard pen size to hold 27 or 28 pigs per pen. We remodeled that barn so that we could get equal floor space between 10 pigs per feeder hole all the way up to 16 pigs per feeder hole.
Yeah.
Sorry, correction. 18 pigs per feeder hole.
Okay. And I know we've replicated that one a couple times where the pigs will have either the same space or different, more feed space or less, trying to figure out what's the most important. Is it density or is it number of feed holes per pig or pigs per feeder hole? But just trying to figure out what's important. You've done a couple of those studies, at least two.
Yeah, we've done 3 of those. The question was raised on a wet dry feeder, what is the recommended number of pigs per feeder hole? We couldn't really get an answer to that question from the makers of these feeders. It was a variety of answers. So we decided to go ahead and we'll put it in one of our barns and we'll see what happens.
Yeah, I remember when we covered that several months ago. The results are interesting. I mean, when you see the results of that, you think, oh, wow, feed space is important, or whatever. You can take some things away from it that will guide a person into how they would build the next barn they build with the number of feed spaces they'd put in or the pen size or density.
Yep.
Yeah. And since we kind of touched on it there, all these trials, equipment trials, vaccine trials, different animal health trials, genetic trials, you pull all this stuff together, you write it up, and I would call it publication quality research. Like you put it in a scientific journal. It's well done, statistically rigorous. Who do we partner with to do these? Like let's say it's a vaccine trial. Would we partner with a vaccine company that they say they want to test this thing? How do these trials even come together, and who's our partners in this?
Yeah, so typically we have, we call them sponsors. It's genetic companies or companies that have a vaccine that they want to trial. They come to us and say, hey, I have this product or this boar line or whatever it may be. We have this that we want to look at. Is that something that falls in line with what you guys want to look at? We'll take that back to the research committee, bring it up to them, and if it falls in line with our ideals or what we want to study, then we'll partner with them and come up with a plan and a protocol of what are the outcomes we want to look at first and foremost, and how do we want to go about doing that.
Okay, this is what you're describing is different than like what contract research would be. A lot of different companies do contract research. So in that case, a pharmaceutical company or a vaccine company says, hey, I want to test this. I'm going to pay you, and I'm going to rent that barn, and I want you to do this trial exactly like I want. Then we get done, we take the data, thank you very much, and then the vaccine company has the data. That's very different than what you're doing in that we would only do things that we're interested in, that we would say our producers would find value in. Same type of relationship with the pharmaceutical company as far as, their involvement as well. And there'd be guidance from them, but we would design the trial, essentially. We would have the data. It's our data. We also share that with the pharmaceutical company, but it's ours to work with. It's not given to us later. So this is very much, we are in control for our producers' benefit. And also, hopefully, the sponsor of the trial gets great benefit from it as well, because then they have a great trial that understands their product better. Mm-hmm. Is that stated fairly? Or
Yep. Contract research is a different animal. It's exactly what you said. They tell us what they want done, we do it, and we hand everything back over to them. Applied research is we work in collaboration with the sponsors. So we make sure that we're aligned on outcomes and how we want the trial to run. We have our own statistician, Roy Edler, that will run all of the analysis on the data. He does it blinded so that there's no bias involved with it. And then our team, which consists of Taylor Hansen, Andrew Radke, and Paloma Bello, they're the ones in the barn every day collecting all this data. So they know what's going on. We collect it. We send it to Roy for analysis. He analyzes it. We come back with the sponsor, make sure everybody's in collaboration and agrees on the outcome. And then we share it, essentially, and get ownership of that data so that we can use it as best benefits the producer.
Yeah. So then that's really the last part. We do these PAR studies for the benefit of our producers. And so people listening, we're not going into any details of any of the research that's been done, but if you have questions about something specific or how do I get this information, this is where you should get in touch with somebody that you know from Pipestone, one of the veterinarians, the nutritionist that you work with, a production person that you know. This information is for our producers to have access to so they can get stronger in their decision-making abilities by, whether they're part of a sow unit or something different, so they can be a better farmer next year than they were this year by making better decisions, right?
Yep. Everything we do is to answer questions that are relevant to the producer and will help them produce a better pig.
Okay. And I got one other, this might be a left field question for you because you might never ever thought of this, but I wonder, every trial you do doesn't show revolutionary new things. You might test two vaccines against each other and find out there's no difference. How often does it happen that you don't find differences between the treatment group and the control group, or however you want to do it?
It happens on occasion. What I like to tell people is that it's not our job to prove what the sponsor is telling us. It's our job to collect accurate data and be confident in the outcomes that we have, whether that's the sponsor wins or the sponsor loses, or it's even between both. It's not our job to determine that. It's our job to produce a good outcome that we can make sound decisions on that will help the producer. Yeah,
I'm just thinking of something really simple. Two products compared to each other. If you find out one works better, well, that's got a big upside because there's a better product. Let's use that one. But if you test two products and they both work the same, but they both work, mm-hmm. That's even a good outcome there because, now you got two options and they both work. So having good information is its own particular value because you're just smarter because you knew there was no difference, or smarter because you knew there was a difference, but then.
Yep. And that's what PAR is all about. It's not proving one thing right or wrong. It's about finding the outcome and getting an answer scientifically that we can have confidence in and bring back to the industry as a whole to say, this is what we found, this is what we have confidence in, and use that information as you will.
Okay. Paul, you've got these really nice barns. They're set up to get high quality, statistically relevant and meaningful results. That's your setting. What differentiates that compared to what a producer would find if they did a field trial in their barn? If they said, I want to test these in my own barn, describe the differences and why it's important to do it one way versus the other if you want to get really meaningful results.
Yeah. So the way that we do it is we have the ability to test the products simultaneously. We don't do one vaccine, for example, one turn and then try the next vaccine on the other turn. We do it simultaneously. We also have scales that we can weigh the pigs to get accurate weights on. The feed robot that I talked about, that helps us to get feed intake and conversion. So just the ability to do those kind of things kind of separates us from a field trial per se of doing one vaccine one turn and one vaccine the next turn.
Yeah, no, I can track it exactly. And I thought of one other thing, just the randomness that you need to have in a study, every other pen or random pen assignments versus I got one room on this and one room on another. Mm-hmm. The more you can randomize, the more you can do control for all the variables, the stronger your results will be.
Yep, and that's where our statistician Roy comes in to tell us, okay, if we want this to be meaningful, this is what it needs to look like. So
that would be a difference. You're doing one type of a trial in your barn versus a field trial, which is going to give you an inkling maybe, but not really probably data that you can make good decisions off of,
mm-hmm.
At least not in the same way.
Yep.
Okay. I can think of other things too, where you will do a challenge study in your barns where a farmer with a barn that he wants to test a product and is not going to intentionally infect his pigs, mm-hmm. correct?
Yeah, that's fair. And that's one of the things that we have built into these studies. We want to look and see what happens if we have a pig that's not vaccinated with these challenge types too. So we accept that risk as part of producing a good outcome.
Yeah,
at the end.
You just described unvaccinated control. Mm-hmm. So if people listening would say, "Oh, you got pigs you put in the barn, except you didn't give them the vaccine and you intentionally made them sick." Most farmers won't do that to their own barns because a lot of those pigs can die and sometimes do die in your research settings where if you would do it on your barn and you're thinking, why did I do that? Mm-hmm. Never going to do a trial again in my barn if half the pigs die because I didn't vaccinate them.
Yep. So. And so when we do a control, that we accept that as our baseline, right? So we do these vaccines and then we have a control group so that we can understand how much better is the actual vaccine rather than just not vaccinating your pigs. It also gives us an answer of vaccination is pretty important.
Yeah. If you're comparing two products that work equally well, they should work better than no vaccine. That's why that unvaccinated control is important.
Right.
Okay. All right. Thanks, Paul. We've hit about 20 minutes of recording. Anything that we have not covered that you think is worth discussing a little bit?
Not really. I think we've covered everything pretty well. I know my team would be a little upset if I didn't shout them out. I think
give the shout out.
I think I did. So we have a great team, very dedicated to integrity and accuracy. They try to do everything right on a daily basis. So shout out to them, Andrew, Paloma, Taylor, Roy is our statistician. They do a great job. I wouldn't be in the position that I am without them. So very, very happy to have the team that we do.
All right. Paul Frahm, thank you for joining us today. I really appreciate your time.
Thank you.
Thank you to our listeners for joining us, and join us on the next episode of the SwineTime Podcast here at Pipestone. The SwineTime Podcast was created for the pork industry and individual pork producers around the country. Hosted by me, Dr. Spencer Wayne with Pipestone Veterinary Services, the podcast contains pork industry news, advancements in animal care, and how to enhance your productivity. Find the SwineTime Podcast at www.pipestone.com or on your favorite listening platform.